Hello everyone, and thank you for joining me today. In this video, I will go over pharmacology principles in advanced health assessment. You will learn pharmacokinetics, pharmacodynamics, special population, prescribing consideration, and then I will summarize the lecture, and I have discussion questions in the end. So stay tuned and thank you. In this lecture, I will go over the learning objectives, pharmacokinetics, pharmacodynamics, special population, prescribing consideration, and then I will summarize the lecture, and I have a discussion questions in the end to help you memorize or remember what I lecture in here. Our learning objectives are understanding the key pharmacokinetics and pharmacodynamic principles, explain drug absorption, distribution, metabolism, and excretion, identify considerations for special population, and apply safe prescribing practice in a clinical scenarios. For overview, pharmacology supports safety and effective prescribing. Understanding drug action is essential for psychiatric nurse practitioner practice. Emphasis on individualized care and risk mitigation are essential. Pharmacokinetics. Pharmacokinetics is the study of the drug movement through the body. The word kinetics means movement. Also remember the word army. Army is absorption, distribution, metabolism, and excretion. When we take a medication, it goes those 4 phases. We swallow the medication, and then we absorb the medication, and then our blood system distribute the medication, and then we metabolize, and then we excrete. Pharmacology absorption principles is influenced by the route we take the medication through, the form of the medication, the pH, and the blood flow. First pass metabolism reduces bioavailability. Distribution principles. Drug is transported by the bloodstream and is affected by the protein boundaries and the tissue permeability and volume of the distribution. So the medication distribution is affected by the protein boundaries. We will learn that later. And the tissue permeability, how the medication can go through the tissue, and the volume of the distribution. Metabolism has 2 phases. First phase is the oxidation, reduction, hydrolyzing, involved by the enzyme CYP450 enzymes. Phase 2 is the conjunction reaction, increase solubility for excretion. What are the excretion pathways? Primary excretion pathways is the kidney, is the urine. Also, we excrete drugs or medication through the bile, pulmonary, sweat, saliva. Clearance determines the drug duration. Pharmacology dynamics is the study of the drug effect on the body. So it's what the drug do to the body. It includes receptor bindings and the dose-response relationships. Receptor theory basis. Drugs bind to receptors to assert their effects. Affinity is the strength of the bond. Efficiency is the ability to produce response. Agonists versus anti-agonists. Agonist is activated by the receptors. Anti-agonist is blocked by the receptors' activity. Partial agonists produce submaximal response. Therapeutic index and safety margin. Therapeutic index is a ratio indicating relative drug safety, and higher is better. Medium toxic dosage. The dosage that causes toxicity effect in a 50% of the population. Medium effective dose is the dose that produces the desired therapeutic effect in a 50% of the population. So there is a formula, therapeutic index equal to TD 50% and ED 50%. That's how you know how therapeutic ratio is. Narrow of the therapeutic index drugs require dose monitoring because they have a higher toxicity. Safety margin include a close flexibility. Half-life and steady state. Half-life is the time for the 50% of the drug eliminated from the body. Steady state is achieved after 4 to 5 half-lives. They both been used to guide dosage intervals. Drug interaction types include pharmacokinetic, absorption, metabolism, excretion. Pharmacodynamics include additives, synergistics, anti-agonists. Cytochrome P450 systemic summary. They are major enzymes family in the drug metabolism, and they have clinical relevance for drug effect. Enzyme inducers. Enzyme inducers increase drug metabolism and lowers drug level in the body. Examples of these medications are rifampin, carbamazepine, and phenytoin. While enzyme inducers increase metabolism and decrease drug level in the body, enzyme inhibitors are opposite. Enzyme inhibitors decrease metabolism and increase drug level in the body. Examples of these medications are ketoconazole, fluoxetine, and grape juice. So enzyme inhibitors increase toxicity because there is a lot of drug staying in your body. Special population. Children have immature liver and kidney function. They require weight dose calculation because their weight is smaller they need a weight calculation dosage, and they have a higher metabolism rate. Elderly populations, they have reduced kidney and liver function. They are risky for polypharmacology. They are taking a lot of different drugs that can interact and that can have a lot of side effects. So start slow and go slow. So you start slow, you begin with lower dose, and then you increase slowly the dose if you need to. What are the considerations before prescribing medication to pregnant population? Consider placenta drug transference. Is this medication risky to the fetus? Use, pregnancy category, and lactation safety. For the renal impaired population, adjust the dose for renal clearance drugs, monitor creatine clearance, or EGFI, how the kidney filter the drug. For the hepatic impaired population, they have reduced metabolism of the hepatic clearance drugs. They cannot clear the drugs quickly, so they are risky of accumulating the drug and toxicity. For the psychiatric mental health nurse practitioner role in the pharmacology management is to assist the patient specific factors, to monitor efficiency and side effects, to educate the patient and collaborate with the patients. For medication enhancement strategy, simplify the regimens, address the cost and side effect, use reminder and follow up. For the risk control in prescribing, screen for substance usage, use prescription drug monitoring program that involves providers logging into the state database to check patient control substance usage history before prescribing, and document rationale and monitor plans. Black box warnings. FDA strongest warning highlights the serious risk must inform the patients before prescribing the medication or the treatment. For controlled substance basis, Schedule 1 to 5 based on abuse potential medications require DEA registration number and follow up state and federal laws. Controlled substance require safety monitoring, risk mitigation, and adherence to legal standards. For the safety prescribing practice, verify the indications, use the lowest effective dose, monitor for adverse effects. For example, we have a case study example is 50 years old with the depression and insomnia. We started with SSRI, and then the patient developed GIFZ. We will adjust the dose and provide education about the medication, treatment, side effects to expect, and then follow-up appointment. Our second case example, we have 70 years old with hypertension and anxiety. We prescribed a beta blocker and the patient experiencing low heart rate, bradycardia, we have to switch to alternative medication that will not lower the patient's heart rate. For summary, pharmacology is the fundamental for safe prescribing. Understanding absorption, distribution, metabolism, excretion, and receptors dynamics tailor therapeutic to individualized needs. For our lecture takeaways are: know pharmacokinetics and pharmacodynamics, consider special populations, prioritize safety and adherence. For our discussion question is: how do you adjust the dosing in renal impaired patients? What strategy improves adherence? How to manage drug interaction? Those are the questions to consider. Thank you for joining me today. I would love to see you in my next video.